When I was in medical school, people used to always give me the feeling that it was better to be in medicine 30 years ago or 40 years ago. When I was in medical school, people who are older physicians, used to give you either the direct or the indirect feeling that doctors were better 30 or 40 years ago. The medical students were stronger. Everybody was much more committed. Now, one of the things I thought about later on was, well, we can do angioplasty now that didn't exist even into the 1970s. We have an MRI that didn't exist until the late 80s. In fact, didn't become standard everywhere until the 90s. We have a 95% cure rate in AIDS. We can put in cochlear implants that restore hearing to the deaf. We could have ways of refixing your retina that restores sight to the blind, or popping out a cataract in 4 minutes. So I used to go and say, why did you say it was better to be in medicine 30 or 40 years ago? It's not true. We have to learn much more now. How many antibiotics did you have to learn 40 years ago? Should we use the penicillin or the sulfa, or the sulfa or the penicillin? So what did they do all day long when they were in the hospital on call? Should we give the penicillin, or should we give the sulfa? Should we give the sulfa, or should we give the penicillin? So I'm here to tell you that this is the best time ever to be in medicine. This is the best time ever to go to medical school, to be in residency. We have never been able to do more, to heal more, to cure more. And you know, one of the things that people don't realize, because it's too subtle, is that when I was an intern, it was like okay to be cynical and insensitive towards patients. It was socially acceptable in the hospital. We used to use terms like Gomer. Most of you have not even heard of that. We used to use all sorts of terms that were like, man, refer to admissions as hits because they're hitting us. Not like they're sick people who are waiting for our help. So what's changed is because duty hours are more humane, is that the doctor is more compassionate. Interns and residents these days are much more compassionate, much more empathetic, much more concerned about pain and discomfort than we were 30 and 40 years ago. Because 40 years ago it was easy to be socially acceptable to say, I've been up for 36 hours, don't talk to me about your pain, let me talk to you about my pain. Now we say, I'm sorry you're sick. How can I help you? Hope I can make you feel better. I have an implantable defibrillator that will raise the dead. I have the ability to pop out a cataract that restores sight to the blind. I have seizure surgery that cures seizures. I have the ability to take 90% of patients out of mental hospitals and put most of them into the community that casts out demons. What are you doing all day long? You just going to work? No, I restore sight to the blind, cast out demons, raise the dead, make the deaf hear. I do routine miracles because when you ask yourself, if there is a compassionate divine being in the world, how come there's so much suffering? How can anybody's child become sick or injured or damaged or hurt by someone else if there's someone compassionate who cares about us? And the answer is that divine and cosmic forces of goodness, beauty, truth, and hope and love come to the earth continuously as invisible rain to nourish our souls. But all the implementation, all of the action, all of the doing is up to us, because those divine forces of goodness come to the earth as far as the range of the human heart and mind and our conscience. Like an internet to divinity, like a webcam to the universe is our conscience. And it's never been better in medicine, and we've never been able to help more. And don't let anybody ever make you feel anything different than that we're getting better all the time, every day.